I'm Suzie Ali-Hassan. I'm the National Director of the NHS Innovation Accelerator. So it's lovely to see you all here today and talk to you about the programme. We also have two of our alumni and NIA fellows to talk to you about their lived experience. So we're really grateful that you could come along. Thank you. So the NHS Innovation Accelerator, we support innovation scale across NHS England. Forgive me, I'm just getting my clicker ready. We are commissioned by the Accelerated Access Collaborative, which many of you would have heard of at this point, in NHS England and Improvement. And we're delivered in partnership with the Academic Health Science Network, of which we are based on their stands here today. So they're a really important delivery partner for us across the regions within England. We support the uptake and spread of promising innovations within the NHS. And we really engage around evidence and generating practical real-time insights to support national strategy. We have a dual focus, so we support the innovations themselves, and we're really, really keen on supporting value-based innovations on market, evidence-based, but we also support fellows, the fellows themselves, and it's a fellowship program, so it's very much based about the person themselves. We look to innovations from any background and any type of innovations themselves. So that can be service-based, technology-based. Our partners, the Accelerated Access Collaborative, the AHSNs, and also the Clinical Entrepreneur Programme, we are a sort of a sister organisation, so we really want to support clinical entrepreneurs coming off that programme onto the National Spread and Adoption Programme through the NIA, and of course SBRI Healthcare. So far, since 2015, since the NIA was launched, we have 82 fellows representing 84 innovations, and we have supported 29 clinical-based or clinical entrepreneur-based fellowships as well. These are some facts and figures, so there's lots of impact. We really support leverage funding and investment through the fellowship, and we're really proud of our economic growth metrics as well. So what do fellows receive? So this is really the critical piece and really the matrix of support that's provided. So we've got the core program team, which is sat within UCLPartners itself, the AHSNs, which support local and regional uptake and spread. We then have a fantastic network of mentors, which have experts and a breadth of skills in various experiences. And then there's a peer community, the fellowship itself really supporting each other, but also the broader network of other accelerators within the country and also internationally as well. And then there's a core learning program. So there's a quarterly events based tailored to what the fellows themselves need, and based on what you ask us for. Really, we can really provide a bespoke program for you. And then we help you engage with the broader innovation ecosystem as well and connections across the health and care system. So we are looking to recruit. We're open at the moment. The NIA applications for next year's 23-24 cohort open on the 1st of September. So we're really seeking innovations that support and develop elective recovery and operational challenges post-pandemic, but with particular interests in areas of maternity, mental health, severe mental illness, cancer, respiratory disease, cardiovascular disease, and urgent and emergency care. And of course, underpinning all of this is a focus on the Core 20+5 and the health inequalities agenda. So please do get in touch if you need any more information about those, but we're really keen to support innovators apply onto the programme. There's a high-level assessment process, so through the applications themselves, we'll screen and assess them. There's shortlisting, there'll be an interview with experts based on the innovation itself, and then there's a selection process and some due diligence on the innovation itself. So it's quite a robust process. It's been in place for a number of years. It's supported by the AHSNs that help delivery at the other end of the spectrum. And we're really keen that what we take onto the fellowship, we're able to deliver and have impact longer term for and within the NHS itself. So before I hand over to our fellows themselves, just to say we've got a little bit more detail and in-person sessions available across the country upcoming over the next month. So Leeds, Bristol, London, Manchester and Birmingham. We've got some webinars in place, and we're really happy to talk to you directly. So do email us at nia@uclpartners.com. And follow us for further information. Really keen to hear from all of you. The programme team is here, Mindy and Morgan and myself. Please do come and chat to us throughout the morning. Right, so delighted to hand over to Liz Ashall-Payne, the CEO of ORCHA, for your lived experience.
Okay, so thank you so much, and thank you for inviting me to share with you my experience of the NIA. What I want to do is just give you a little story really about where ORCHA started, what we do, what we did, why we joined the NIA, and the impact of the NIA. And the first thing that's going to become really obvious as I'm talking is I am a massive fan, and I don't believe ORCHA would be where we are if it wasn't for the NHS Innovation Accelerator. So I started out my career working in the NHS as a speech and language therapist, working in complex paediatric care a long time ago before we had technology, and ultimately got really passionate about the fact that as a clinician I could only see one patient at a time. Fast forward 15, 16 years and we started to see computers on our desk and smartphones in our pocket. And just forward on, and we saw the rise of digital health. Now, at the time, I was actually working in an academic health science network myself, and I got really excited because I thought, wow, there's all these digital health technologies out there which could be deployed to millions of people at the same time. And I was fortunate enough to meet some of these amazing innovations, but nobody was using them. The NHS wasn't aware of them, and they didn't know which ones they could trust. And so I got obsessed with, well, why? Why are we not adopting and embracing innovation? And I looked to other areas of healthcare and how we distribute healthcare in other parts of the world, and looked at medications and drug prescription. And if you think about what happens in the world of drug prescription, there's a very clear licensing process. So we sometimes hear that it takes 17 years to get a new innovation into the NHS. And that's founded on this format, which basically means that there's a big regulatory process, but that's about building trust. What we then have is the British National Formulary and a prescription infrastructure. And what I wanted to do was set that up for the world of digital health. So you have digital health standards. You then have assessment and training at scale. You then have digital formularies and data and intelligence which drives forward transformation. Now, this was about 7 years ago when I had this idea, and I managed to get some seed funding. And we also managed to get a first NHS partner to work with us, which was Lancashire and South Cumbria. And that was really exciting. We then got another NHS organisation to work with. So we were already making some strides. So I suppose at the time the question was, well, how do we scale? Because we've got the same challenge as everybody else. People aren't aware that we exist. People don't know if they can trust us. People don't know if we're going to have the right impact. And so that's when I applied for the NHS Innovation Accelerator and went through the process that was just described. And it is a very thorough process. I learned a lot just going through the process. But the day I got the email to say that we got onto the NIA was just amazing. I knew it was a game changer straight away. So that was around about 5 years, and as was mentioned, I'm now classed as an alumni, which is really scary because that almost means that I should know everything, and I absolutely do not. So I still stay very well connected to the NIA and all the other fellows. But since that time, we've massively scaled. So we now work across 80% of the NHS, providing that infrastructure I've just described around assessing to what you will now hear called the DTAC. What we then do is we create digital health formularies at local and organisational and regional level so that high quality innovations can be pushed out into clinical care, and we have the wrapped around governance. But what's really interesting about the NIA, it's not actually just about the NHS. We had incoming inquiries from international partners, the first being the Netherlands, but we now work across 12 countries. So just this week I've been launching the Nordic, which is the equivalent of the DTAC, but across the 5 Nordic nations. They want to learn from the NHS. So this is a platform not only for the NHS, but also international scale and spread. And there are 3 key things that you'll get if you get a place on the NIA, which is competitive, but it's so worth going through the process for. The first thing you'll get is trust in your innovation. And the reason you'll get trust is because of that process they'll put you through. They do due diligence from every side of the equation. But also, once you've gone through that process, people know they can trust you. That's massive in this space. It's a huge differentiator. The second thing is they then raise awareness and access to your innovation. You will get invited to meet with everybody and anybody, invited to speak at sessions like this, and that is absolutely invaluable. And this one here, which I found really powerful, which I hadn't expected, which was the network, not just with the wider community, but also with other fellows. It's a hard journey and you need to keep energised. And the best way to stay energised is to be working with people who are on the same journey as you. And all of that is underpinned with access to information, learning and mentorship. And I just want to say a massive thank you to the NIA, not just for having been on the programme, but for the continued support that we get. And I'm going to be around, so if anybody wants to ask me any questions, very happy to do so. Thank you.
Thank you, Liz. Elliot.
Good morning. So let's start off on a positive note. There's a demand problem in healthcare. We don't have the candidates, the resources to meet it. It's scary. But we do have a lot of good technology. And there's a whole ecosystem of technologies. Just to place Infinity in the ecosystem, we see there being health record systems, analytic systems, workforce tools that help make sure that we've got the right staff in the right place at the right time, but also huge amounts of patient apps, communication tools, so we're ditching the pages. And then there's this task management layer. That's Infinity. So we get stuff done. Workflow, task management. And to give you a sense of what that looks like, currently, healthcare is coordinated like this. We know that 60% of adverse events are due to poor communication at the point of handover. And that's because we still do things in very manual ways. So our goal, our ambition, is to put a prioritized task list in everyone's pocket so everyone knows what they need to do, whether it's been done, what their colleagues are doing. And so this is Infinity. It scales to desktop all the way down to mobile. We send push notifications. And we're now involved with an awful lot of projects around elective recovery. And that's our main focus at the moment. And what we can do is make sure that staff are notified. They can see the full context of tasks that they're being asked to do. They can then update it, and all of their colleagues know what's happening. We can also automate a lot of processes, and given that time is so precious, clinical time is the most precious thing we have at the moment, being able to automate a lot of the admin tasks is critical, and that frees up an enormous amount of time for human beings to do what they're good at, and it allows computers to do what they're good at. A bit like ORCHA, we're in a different way, we're trying to enable other solutions as well. So Infinity is this lightweight tool that sits on top of a health record. But we integrate with health record systems, but we can also integrate with patient engagement platforms, remote monitoring solutions, remote diagnostic solutions, and apps, digital therapeutics. And we genuinely think of ourselves as a way to enable other innovations. So if you're interested in getting your tool implemented into clinical practice safely, come and have a conversation with us, especially if it supports elective recovery. We've done quite a lot of evaluation. Our most recent evaluation is demonstrating over an hour and a half is being saved per person, per shift, within out of hours within a hospital. This is quite a lot more than we were even hoping for. So this is a statistic we're very happy with. And we also know that staff like what we do. That's really important to us. We're very user-centered. And so we spend a lot of time listening. And this is something you'll learn as part of the NIA and any good accelerator program, that you've really got to listen to your stakeholders. And something else that this indicates is that we're making things safer. So we're not just saving time, we're not just saving money, we're making it safer. So we joined the NIA having secured one customer in the NHS. And we'd applied the year previously as well and got rejected because we didn't have enough scale. We now have been implemented in over 10 NHS organisations, more than 40,000 staff use Infinity. And I think that that's a direct result of being part of the NIA. So it's an enormous opportunity to scale your solution. It's an opportunity to learn. But it's also an opportunity to get you in a room that you might not otherwise have been in. So as a part of being on the accelerator, NHS England were looking for solutions that might help with support with outpatient transformation and elective recovery. As a result of being within the cohort, we were invited into a room with the directors of elective recovery, and we were able to present what we were doing. We're now working on NHS England supported pilots to transform outpatients and reduce waiting times for trusts. The other thing I'll say is about support. So you'll get an awful lot of support from the NIA themselves, and they're amazing. But you're now in a group of other fellows that are also trying to solve really difficult problems, and they really are. The best thing about the NIA is the other fellows, in my view. And so, like, we're now working with ORCHA to do our DTAC, so thank you very much for that. But we're also working with Dr. Doctor, who is a very first, or year one, I think, not year zero alumnus as well, and on our elective recovery program as well. So there's real opportunity to work within the network and support one another, and a rising tide will raise all ships. And then finally, what I would say is learn. Listen and learn. Be willing to adapt. Be willing to change some long-standing opinions that you had about the direction your business was going in, because you're going to get some really focused advice. And my last tip is, if you think you're ready, apply. You may get rejected. It might not be the right time, but pick yourself back up again, come back the next year and go again. That would be the best tip I'd give you.
Thank you very much, Elliot and Liz. We're really happy to open to any questions that you may have. Any questions in the audience?
Hi, I'm Prashant from Arden Gym CSU. So I'm an NHS organization. So if you're looking for a particular solution in an area, how do we link up to the new innovations so that we can implement? Or sometimes we may not even know what is the solution. I may come to you asking a question, how can we improve care for respiratory patients, if I say that? Would you provide support to us in finding innovation as well as giving the support to us as well?
Yeah, I mean, so certainly within the NIA program, there are a number of innovations and technologies that could support and enable better care, and it's all about getting sort of improving health systems really through technology and innovation. I would also advise that you work with your local academic health science network, the AHSN. They have a remit around supporting local hospitals and providers, make change, make improvement, and innovate. So definitely seeking innovation that sits within the NIA and the alumni, but also your local AHSN should be able to support you as well, find what you need. Any other questions?
Hi, so I'm Billy Webber from XR Therapeutics. Somebody considering applying for this. So my questions to you two. Great presentations, by the way. I really enjoyed them. You both mentioned the upscale of your businesses from joining. Can either of you draw a direct line from an event you attended, a networking session, to direct business?
Shall I go first? Shall me to go? So what I would say is a direct line is never what happens in business. But what I would say is there's a layered approach. So that first layer being trust. People who, and organisations and innovations that achieve a place on the NIA, the wider ecosystem know that you've gone through a process of due diligence, which is really powerful. So that's the first layer. The second layer is then helping to raise awareness that you even exist, because it's a busy world out there. So to your point for the question over here about how do I find out about these innovations, that's actually a big problem, and the NIA give you a platform. The next layer is then introductions into meetings that you would never, ever get introduced to. And so you get the opportunity to influence and get the opportunity to speak with people you probably never, ever would have done. But obviously the other bit is about what you bring to the table, and you've got to bring tenacity and hustle. So once you've got those layers, you've then got to really embrace it. And I think that the final bit for me is then other fellows. So could I draw a line? Yeah, I probably could. Was it the golden bullet? No. But I think that it's the strong foundations for the rocket ship to launch. Lots of analogies in there, blimey.
Does this work? We do have a direct line. So NHS England post vaccine booking were turning their attention to outpatient transformation. They reached out to the NIA and said, "What have you got?" And a number of the fellows were saying, "We would really like to get in the room." So an offer came out to all the fellows. We responded saying, "This is what we can do in elective recovery." That was sent back to NHS England Directorate. They picked the ones that made sense. They invited us into a room. 3 months later, we had a contract. But also, just look at the scale we've had. And it's hard to draw a direct line, but I think it's fairly clear that it got us somewhere. But I would also say that it's a shortcut. So it used to be that we had to explain, yes, we're ISO 27001 and we're storing your data correctly. And yes, we've been used before and we're clinically safe and we do clinically safe. It's now, we've actually heard it. Well, you're on the NIA, so all of that stuff's done, so let's get on with the real stuff. So yeah.
Yeah, thank you all for great presentations. I really love your point about trust. What can you say about this due diligence process? A little bit more detail, and also about I heard it's about, also the fellow itself. That'd also be interesting to hear a little bit about, like, what kind of, what's that assessment like?
Sure. So the due diligence process is focused really on evidence and the ability for that innovation to potentially scale. It's really important that the program can support impact. So we want to make sure that any innovations onboarded are ready for scale. So you've got your regulation tied up, you're on market, you're ready to create customers that we can sort of support through leverage and introductions nationally. So that's what that assessment is about. It's really important that you're understanding your innovation's impact and value proposition for the health system. That's critical too. And I think the whole interview process really goes along that line. So it's evidence-based, ready for scale, ready for NHS engagement.
I just wanted to also add that it's also, when I went through the process, there was a lot of questions around what are your gaps. So, of course, you've achieved some level of success. You've got to have achieved some level of success to have that evidence base. But also, what do you want to get out of the NIA? And how do you think they can help you to scale? And that's when that bespoke tailoring comes in around the programme.
Yeah, and just to add, it is also about the person, and that's why the fellowship element is really important. So I think, we want to understand what you need from the programme so we can provide that back to you.
Hi, my name is Ricardo. I came abroad from Portugal, and I was wondering if you accept to have companies from other countries.
Absolutely, yes. So the programme is focused on the NHS in England, but we are open to international innovators, absolutely. It's about the best technology supported within the NHS, so yes. Any other questions? As I say, I'm going to point Morgan out here. She's our comms and engagement manager. She's very happy to talk to you and answer any questions as well. And Mindy's at the front in blue, really keen to discuss. And please do come along to one of those webinars to find out more.